Good morning. We continue with our heart failure awareness series. This whole week we are learning about the symptoms of heart failure. In episode 4, we learned about the major and the minor symptoms of heart failure. And today I discuss more on a very common symptom of heart failure, swollen feet. Might your heart be talking? How many times have you noticed your shoes are tighter at the end of the day than they were in the morning? Or when you press on your ankles, you leave a deep mark. You remove your socks and you find there's a depression where the socks were. These are minor signs that sometimes that we brush off, that you have stood for too long, the sun was too hot, but it may be a warning sign that there's something wrong in the body. So why does this happen? When your heart is not strong enough to pump efficiently, the pumping power weakens. The blood accumulates back in the veins. The kidneys sense that something is wrong and the kidneys retain salt and water. When this extra fluid build up, it does not remain in the bloodstream, but it starts leaking into the soft tissues. It collects in your legs and the ankles, and sometimes even in the abdomen and the chest. This is why we say heart failure is a problem of fluid overload. Fluid overload means you retain fluids. You are not able to pump well. Your kidneys cannot efficiently clear that water. So it's not just about the heart. It is about the whole circulation, not able to maintain the balance. And what happens is that when you retain fluids, the fluid is not just retained in the legs. Your legs will start swelling. The fluid can also accumulate in the abdomen. So you notice your abdomen getting larger. This is what we call ascites. And the fluid can also accumulate in the lungs. What we call, you can get pleural effusion, fluid in the lungs, or even pulmonary edema. And this is what leads to breathlessness. So if the fluid accumulates in the chest, you are not able to breathe well, you feel congested. If the fluid accumulates in the abdomen, you find your abdomen getting bigger. Once you eat small portions, you get full fast. And the obvious one, the leg swelling. Remember, we just finished our VTE awareness, where we learned that a clot in the leg can present with one leg swelling. So one leg swelling is DVT until proven otherwise. However, in heart failure, it is swelling of both feet, not one leg. Both feet are swollen in heart failure. The kidney can also cause fluid retention, but if the fluid retention is from the kidney, the face also swells, facial puffiness. So if you have leg swelling plus facial puffiness, that may be a sign that the problem is in the kidney. Heart failure rarely causes swelling of the face. So don't ignore that swelling of the leg. Don't assume it is just weight gain. Don't assume I have been studying for long. It may be the body sending a sign that something is wrong. Remember, in this awareness series, we want to be aware not to miss the symptoms. If something is wrong, we want early diagnosis. With early diagnosis, early treatment so that we can slow progression and even sometime reverse the condition. So what are the red flags to make you concerned about that swelling, to make you concerned about that you are retaining too much water? If you have swelling of both legs that does not go away with rest, if there is an associated swelling of the abdomen, we call that ascites, it tells you are retaining fluid. If there is also congestion in the chest, if I'm feeling breathless plus swelling of the leg, that is a warning sign. If there is swelling of the legs plus breathlessness, in episode 4 we learned about orthopnea. I cannot lie down at night flat and then my legs are swollen. You must think of the heart. Don't ignore those simple and common warning signs that may be your body crying for help. And remember, when the swelling is recognized early, we are able to start treatment early and we are able to slow the progression or even reverse the heart failure. So my call to action today, check your ankles. Do they look puffy this evening? Do they leave a dent when you press with a finger? Is the swelling becoming regular and a common day to day? Not just a day. If it's heart failure, you are finding repeated regular swelling. If the answer is yes, do not ignore. Don't blame the salt. Don't blame studying for too long. see a doctor so that you can have a complete evaluation. So stay tuned for the next post where we will discuss more about the common question we ask. Are you able to sleep flat? Do you use pillows when sleeping? What is orthopnea in heart failure? Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.